Okay, so I have my gravity tubing going. My patient is fine, but the physician came around and he wants to change the rate. He wants the rate to go faster. So I know that I have to put it on the pump so it can be more accurate. So I have my primary IV plump set right here, and I am going to use it. Tags out. Alright. Okay. So I have my plum tubing. First thing I'll do, I will get the cassette part here and make sure that this clamp is pushed in. Okay, good. I will now disconnect my IV from here. Before I did all this, I washed my hands, so I'm all set. So I'm just going to do that. Make sure I put it up here, keep it sterile. If I had a problem about whether it was going to be fine, I would put a blunt needle on there just to make sure I keep it sterile. Okay, I get my bag down and I turn it upside down. I take my spike out and I hang that up as well. Perfect. Making sure not to contaminate anything. So I have my bag down here now, and I'm going to spike my bag. So I take this out and I'm going straight down, making sure not to go off to the side. Good, so I'm in and I'm going to now hang my bag up. My bag is up. And I'm going to fill my drip chamber to the line halfway here. Okay, good. I think this is good. Good. Okay, so now I have my drip chamber filled halfway. I will now go and fill my cassette. Cassette, I have to hold it with the part that shows the map of Minnesota and this way. Okay, so I have it this way with the part that's facing me with this point down, and I am now going to make sure that I pull out the clamp slowly and let it fill. And the Minnesota part will fill first and then the other parts. So I will pull it out. Yep, it's coming in. Okay, then I turn it upside down. Alright, and I fill it. Okay, and it's filled, so I push it in now, clamp it down nicely. Good. Okay, so I have pushed in the knob, it's clamped, and now I'm just going to attach it to my to the patient. So before I do that, I will just scrub the port. I already know that the IV is patent because there was the I already know it's patent because there was an IV running through it. So I'll just scrub it up nicely and attach it. so I'm scrubbing nicely, all set. Okay, that didn't touch anything. And now I'm going to just attach it. Holding it and go sterile to sterile in. Okay, and then I will secure with some tape because I don't want to lose my site. Okay. Okay, so I got it secured. Okay, so now I am going to put the cassette inside of my machine. And so I hold it, and this is the way I have to hold it with the Minnesota towards me. This spot, hang on to that spot, and I have to place it into the machine. Okay, so this is how I would place it. I would hold it like this, and I would place it in the machine this way. So this would be the placement of my cassette right here. And then there's a sort of a clamp thing. A lever, I would just bring it down, and so keep it in place. Okay, so that's what I would do. Now after I have my cassette in place, I would turn on my machine. It would beep, and then there would be a self-test that would appear in the screen here, and there would be lights coming on, a self-test, and it would be checking to see whether the cassette is primed correctly. But my cassette is fine, everything went well. And so the next thing is I'm just going to press A for primary, and then because that's what it was on. Now it's asking for the rate. So the rate, the order was switched from 1,000 mils in 8 hours to 200 mils per hour. So I would press this knob, and I press 200. That'll be 200 mils per hour. I put that into my machine. Then the next thing I would do is the volume to be infused. So my bag is a 500 ml bag. So I would put 450 just to give some leeway. So I would press this level down here, this arrow down here, and I put 450 in, and the machine would calculate that this IV would be done in 2 hours and 15 minutes. And I would press start, and that is what I would do with my machine right here. Okay, now the next thing I would do is to make sure my bag is labeled with the date. I have a pre-labeled thing here, put the date right here, and I would also take some tape, and I would write down the date, and I would label my tubing. Okay, so I've done that. I would wash my hands, go out, I would chart. What would I chart? I would chart the rate, the volume, how much fluid am I putting in, the fact that I put in new tubing, the condition of the site, because while I was putting in the new tubing, I would have looked at the site and made sure that everything was fine, and if there was any complication or with the site, like occlusion, phlebitis, infiltration, or any of that sort. But that was not the case, so I would chart all of that. Rate, volume, new tubing placed, condition of site, whether there was complication, and then when I'm done, that would be the end of my skill.